and mighty the wars around.
Makerere University School of Public Health is one of the leading public health institutions in Africa. It was founded in 1954 as the Department of Preventive Medicine and became an Institute of Public Health in 1974. In 2007, it was upgraded to the School of Public Health, one of the 4 schools under Makerere University College of Health Sciences. Right from the beginning, the school has had a solid foundation, mainly because of strong leadership, which set the school on a path to becoming a center of excellence in providing leadership in public health in Africa. Professor Josephine Mary Namboze, who headed the Institute of Public Health between 1978 to 1988, vividly remembers these times.
I joined it indirectly as medical officer for Kasangat Health Center, which was attached to the then Department of Preventive Medicine. This establishment has passed through the stages of a Department of Preventive Medicine, and then it became a Department of Community Health, then an Institute of Public Health, which finally became the School of Public Health. The numbers of students were rather small.
In the late 1980s and early 1990s, emphasis was on preventive medicine and upgrading the program from diploma to a master's.
The Master of Public Health program, which is 25 years now, is our flagship program for the School of Public Health. It is the backbone program for many of the other master's programs that we have in the School of Public Health. We are doing the 25 celebrations of the Master of Public Health program to acknowledge, first of all, the contribution that public health has made to improving the life of Ugandans. As we are aware, Uganda is a country where we have a lot of vulnerable populations who are suffering from communicable diseases that are passed on through ways that can be prevented.
When I joined the Department of Preventive Medicine, one key activity was the students' orientation through Kasangati Health Center, which at that time had been supported and sponsored by Rockefeller Foundation. And the idea was, to emphasize preventive medicine in the whole curriculum of training health staff.
So we came in to change a traditional system of a diploma in public health into a master's in public health, but this time with a new ideological thinking. The ideological thinking was, why should we train public health specialists based in a classroom? This should change. And Rockefeller Foundation then had coined a new attractive word that they called public health schools without walls. This really meant simply training public health school in a practical manner.
The Masters in Public Health program students undertook their research at the districts they were attached to have hands-on training.
One site had to have a district medical officer who had an MPH qualification to supervise those students. And those sites had field supervisors, and we had supervisors appointed from the school or the institute at that time who would follow up the students to go and see what they were doing.
The MPH program that was designed was extremely well designed. It was designed in such a way that 25% of the 2 years of this program is spent in class, but 75% of the students are actually in the district, attached to a district health team, learning through apprenticeship by doing in skills of leadership, skills of outbreak investigations, health needs assessment, to be able to come up with the appropriate competences that they will need to lead a district health team.
Over the years, the Masters in Public Health program has produced some of the finest leaders in public health, serving in different capacities all over the world. Some of them are glad to share their experiences.
I'm one of the 6 that started off the MPH program here in Uganda, as we used to call ourselves the guinea pigs. And one experience I'll tell you quickly is about the learning how to use computers. It was a must that students on this course are given a computer and they learn to do all the analytical work using computer. The interesting thing is that we quickly got to learn how to use computers as a class of 6. But many of the faculty in this institute then had not even touched a computer. So one of the experiences I have as a student was to slowly teach some of my senior teachers how to write WordPerfect and type thing, which was quite interesting.
You learn by doing. That was the model. While in Rakai, I was able to conduct 4 different studies and my dissertation.
Following the background of my undertaking my Master's School of Public Health, when I took up the role of a district health officer, I was able to build a strong district health team, reorganize the scarce resources available, especially the human resource, and guess what? In last year's ranking, after an assessment by the Office of the Prime Minister, my district began ranked 2nd in the country, the health sector.
With this solid foundation, the school has experienced exponential growth in several areas, from one department to a school, from certificate to Masters in Public Health, from 6 Masters of Public Health students to over 600, from a handful of research grants to over 100.
When I joined in 1994, it was an Institute of Public Health with 1 department. And we fought very hard to evolve and transform the institute from a 1-departmental institute into a 4-departmental institute. Epidemiology and biostatistics, community health and behavior sciences, health policy planning and management, disease control and environmental health.
The school has generally grown tremendously over the last 25 years when the MPH program was started. The amount of research that we do in the school has grown exponentially from just a handful of donor-funded research projects to now, on average, anywhere about 100 research projects that we are running in this school at any one time. That has also led to a really rapid growth in terms of the funding that we have in the school for research that has grown about tenfold over the last about 10 years. So we've witnessed a lot of growth in research, in terms of service projects and engagement with the community and multiple stakeholders. So in general, this has also contributed tremendously to the improved rankings for the university as well as the College of Health Sciences at large. On average, for example, in the past 2-3 years, our school produces about 200 peer-reviewed scientific publications every year, which is really big.
Makerere University School of Public Health has been able to scale these great heights mainly because of sound and enduring partnerships.
The School of Public Health was one of our first partners and indeed has remained one of our most important partners here in Uganda. At CDC, we are interested in developing sustainable public health capacity. And so investing in people and in public health capacity to prevent, detect, and respond to disease threats has been a core part of what we've been doing. I think going forward, what we increasingly see in the field of public health and in development is more of a two-way street. We've built capacity in Uganda. There are many Ugandan public health professionals who are working on the world stage. So as CDC, we hope to continue that partnership in not only providing funding support, but also having a technical collaboration.
Reflecting on what the Makerere University School of Public Health does for WHO is it is also a big resource for Master of Public Health graduates, which we found to be of high quality and has contributed to WHO in its work. And in the future, we are looking into how the school could contribute in training in leadership and governance.
Today, as the school plays a critical role in public health, it is inspired by its three core responsibilities. Teaching and learning, which is the main pillar of the school, has undergone several transformations to meet the changing demands.
In the early 2000s, most of these positions in the local governments were filled. And then there came a new need. Civil society organizations also wanted officers, leaders in the healthcare, NGOs, international NGOs. So the MPH had to shift to accommodate the needs of these organizations. And secondly, these organizations also required some more specialized skills in some areas of the MPH. So the MPH adapted and introduced elective courses and also introduced tracks that would enable the officers to sub-specialize in some areas.
We are privileged to have a very vibrant college that has given us an immense host of resources. As distance education students, you would think that once you come to do the course, you're on your own. It is not the case with the school, with the college or the School of Public Health. We are sought after, we are looked after, and the interaction between the professors or the instructors and us, the students, is quite amicable.
Using research to create a vibrant innovation environment to develop solutions to public health challenges.
When we had HIV, it attracted money, both for programs but also for research, since people are looking for vaccines, for drugs, for programs, and for so many things. And they use this opportunity to train people into like a master's and the PhD, but also to start research centers. Now, over the years, after HIV sort of has been controlled, attention to other issues started. So we go back about 20 years ago, and slowly, by slowly, we started an investment into other new research areas, such as health systems, such as maternal child health, and also actual malaria, pneumonia, diarrhea.
Through community service, the School of Public Health has taken a lead in disease outbreak investigations and disaster management in Uganda and across Africa.
In the Department of Disease Control and Environmental Health, we've had a strong community health component, whereby we are involving communities in supporting community engagement, but also community service as one of the key roles that we do at the university here. And particularly I've been involved in supporting the community health system, working with community health workers who are many times referred to as village health teams, mainly because these community health workers are instrumental in our health system and therefore play an instrumental role in supporting health in our rural communities especially. And therefore one of the engagements that we've done is to enhance their capacity through training, supervision and motivation, which has ensured that they are well equipped to promote health in their communities, but also to ensure that they serve better in terms of treating childhood illnesses, carrying out health promotion, but also supporting the health system in general before reaching the higher levels of the health system, including health facilities, but also hospitals and other higher levels in the country's health sector.
As it looks to the next 25 years, the School of Public Health hopes to strengthen and consolidate its position as a leader in public health by adapting to the changing times to meet the public health needs of Uganda in particular and Africa in general.
I see the school growing even further, and I see it expanding its links with the districts and especially with the Ministry of Health.
The College of Health Science will continue to do its part, but I think other colleges need also to really step up in terms of contributing in research, publication, and ability to teach, so as that we could have a multiplier effect.
The role of ICT and multimedia infrastructure in teaching should not be left behind. In order to build a strong e-learning infrastructure to support the teaching, we need to develop spaces like multimedia studios where these materials can be produced.
We need to be broad, and that breadth for me I think is the future, and we really need to inspire ourselves as staff to have an open mind.
I think there must be a system created within the Institute of Public Health that translates science into a common man's language.
Moving forward, what we are focusing on now is to make our public health training more flexible, to be able to reach out to many people out there. We've started with the distance program, which is very marketable, but we are also trying to focus on enhancing further the capacity to do public health research by having very strong PhD programs, including a taught PhD program in public health. We are also looking at expanding the fields of public health to be able to identify and implement programs in critical areas that have been neglected. We are also working on a number of projects related to more community engagement, as well as identifying solutions to some of the chronic challenges within public health.
As part of its infrastructural expansion plans, the school hopes to set up a 36 billion shilling state-of-the-art modern building that will be the new home of the school. So far, 6 billion shillings has been raised and construction is to commence soon.